You ever been somewhere you couldn't leave? Not traffic, not a bad date. I mean truly trapped. Where your body won't obey. Where the people who are supposed to help you don't. Today, I'm going to tell you 4 stories. True stories. From men who thought they were in control until the hospitals proved them wrong. Before we start, where are you watching from? What time is it on your clock right now? Let me know in the comments. I read every single one. And if you haven't already, please hit that subscribe button, tap the like, and turn on notifications so you never miss an upload. Now, let's begin. The blade touched my skin before I could scream. November 12th, 2015, St. Catherine's Surgical Center. Routine hernia repair. I'm a construction worker. I've broken ribs, shattered a wrist, taken a nail gun through the boot. I wasn't scared of surgery. They told me to count backward from 10. I made it to 7. Then, nothing. Except it wasn't nothing. I could hear them. The hum of machines, the clink of metal on metal, a woman's voice saying, "Scalpel." I thought I was dreaming, but then I felt it. Cold. Pressure. A line of fire across my abdomen. My eyes wouldn't open. My lungs pulled air. Slow, mechanical. The ventilator was doing it for me. I tried to move my hand. Nothing. I tried to scream. My throat was stuffed with plastic. The doctor's voice came from above me, casual, almost bored. "Clamp that bleeder, would you?" Another voice, younger, nervous. "Dr. Greaves, his systolic is dropping. It's fine. Just watch the drip." They didn't know. They didn't know I was awake. I focused everything I had on my right hand. Or wiggle a finger, twitch a thumb, anything. But the drugs had me locked inside myself, paralyzed, aware. I felt the tug as they pulled something inside me. Not pain, exactly. Worse, a deep, wet pressure. Like someone rearranging furniture in a room that was never supposed to be opened. And then I heard the words that changed everything. "Oh, no." Silence, the kind that crushes. "Did you mark the site?" the older doctor asked. The younger one hesitated. I thought you did. Which side was the hernia on?" My heart would have stopped if I could have controlled it. They were on the wrong side. They'd cut into the wrong side of my body. "We have to close this and reopen on the left," Greaves said. His voice was tight now, controlled panic. "What do we tell him?" the younger one whispered. "Nothing. He'll never know. We'll note some unexpected scarring, standard language." I wanted to rage, to explode, but I was a passenger in my own corpse. They started stitching. I felt every pass of the needle, not sharp pain, just tugging, pulling. The drag of thread through wet tissue. Then they started again. The scalpel. The correct side this time. I tried again to move. Finger, hand, arm. Nothing. Then I thought about my feet. The paralytic might be weaker there. I focused everything on my right foot, on my big toe. "Move, move, move!" It twitched, just once. Small, but real. I felt it. The younger doctor saw it too. "Doctor, his toe just—" "Reflex," Greaves interrupted. But I did it again, harder this time. A full curl of the toes. The room went quiet. I could feel them staring. The younger doctor leaned into my field of vision, even though my eyes were taped shut. "Doctor, what if he's not?" Greaves's voice was stone. "Finish the retraction." He saw it. He knew. And he kept cutting. I don't remember when I finally went under for real. Maybe they added something. Maybe my mind just broke. When I woke up in recovery, the nurse smiled. "Surgery went perfectly," she said. I looked down at my stomach. 2 sets of bandages, 1 on each side. I opened my mouth to speak, to tell someone, and then I saw him. Dr. Greaves, standing in the doorway, watching me, He tilted his head just slightly. A warning. I never reported it. What could I say? That I was awake and no one believed me? That I had no proof except scars they'd already explained away? I still see him sometimes. In my sleep. Leaning over me with that scalpel. Knowing I'm awake and cutting anyway. You ever think about what silence actually sounds like? Not quiet. Silence. The kind that has weight. I learned what that feels like. My name's Gideon. I work nights as a bouncer. Big guy. Intimidating. That's the job. But I've got a secret. Tight spaces make me want to crawl out of my skin. Doctor said I needed an MRI. Shoulder injury. Rotator cuff. Maybe a tear. I told him about the claustrophobia. He said, "It's only 20 minutes. Close your eyes. You'll be fine." They scheduled me for late afternoon. I showed up at 4:30. The imaging clinic was almost empty. A tech named Sloane checked me in. Young, tired, distracted. She walked me back to the room with the machine. It looked like a spaceship designed by someone who hated people. White tube. Narrow. She handed me earplugs. "It gets loud," she said. I lay down on the table. She strapped my shoulder into a brace to keep me still. Then she slid me in. The tube swallowed me. I closed my eyes, tried to think about anything else. The machine started clicking. Rhythmic, mechanical, loud, even through the plugs. I focused on my exhale. Slow, steady. And then, I don't know. I must have fallen asleep. When I opened my eyes, the clicking had stopped. The lights inside the tube were off, completely dark. I waited for the table to slide me out. It didn't. "Hey," I called out. My voice died in the tube. No echo, just flat, dead sound. "Sloane?" Nothing. I tried to sit up. My head hit the roof of the tube immediately. Panic started crawling up my spine. I wiggled my legs. The table didn't move. I reached down to feel for the release. There wasn't one. Not inside. "Sloane!" Silence. I twisted, tried to push myself backward with my feet. The tube was too tight. I could feel the walls now. Inches from my face, my chest, my hips. I couldn't get a full breath. Not because of air, because my brain was screaming that I was buried alive. Then I heard it. A click. From inside the machine. The hum of something powering on. "Oh, thank God," I whispered. They were coming back. But the table didn't move. Instead, the machine started again. That rhythmic banging. Louder this time. Faster. No one was in the control room. No one had turned it on. "Help!" I slammed my fists against the sides of the tube. The banging got faster. Aggressive. Like it was angry. And then I felt it. The table shifted, but not out. Deeper. It was pulling me further into the machine. I kicked, thrashed. My shoulder brace caught on something, locked me in place. The tube was swallowing me. I screamed until my throat burned. The machine kept pulling. Further. Further. Until I couldn't see the opening anymore. Just smooth white plastic. Curves. Endless. I don't know how long I was in there. Hours, maybe. Could have been minutes. Time stops meaning anything when you can't move. Eventually, the machine went quiet again. I lay there, shaking, soaked in sweat. I started talking to myself, out loud, just to hear something. "You're okay. Someone will come. It's fine." But it wasn't fine, because when I tried to shift my weight, I realized something. The air was thinner, stale. I wasn't getting enough of it. Was the tube sealed? Could I suffocate in here? I forced myself to calm down. Slow inhales, controlled. And that's when I heard the voice. Faint. Outside the machine. "Hello? In here!" I screamed. "I'm stuck in here!" Shuffling sounds. A beam of light swept across the opening of the tube, far behind me. "Oh my God," a man's voice said. Get me out! Hold on! Hold on! I heard him running, buttons being pressed. Nothing happened. It's not responding, he muttered. Manually. Pull me out! I'm just security, man. I don't know how to… Pull the table! I felt his hands on my ankles. He yanked, hard. The table jerked, stopped. He tried again. It wouldn't budge. It's locked in place, he said, panicked now. I need to call someone. Don't leave me. But he was already gone, his boots echoing down the hall. I was alone again. I closed my eyes, tried to disappear into my head. Somewhere else. Anywhere else. The machine clicked on one more time, but this time it didn't bang. It hummed. Low. Almost curious. Like it was listening. They got me out eventually. Maintenance guy with an override key. Sloan had left early. Forgot I was in there. Thought the machine auto-released. It didn't. The security guard found me by accident. Was doing his rounds before locking up for the weekend. If he hadn't, I don't work nights anymore. Can't do enclosed spaces. Can't do silence. And I sure as hell can't do machines. Not anymore. Antiseptic mixed with rot. That's what I smelled first. Mercy General Hospital, West Wing. They called me at 9 p.m. Needed a sitter. That's what they call us. Professional babysitters for adults who might hurt themselves. Or run. $12 an hour to sit in a chair and make sure someone doesn't die on your watch. I'm Vaughn. Done this job maybe 6, 7 times before. Easy money usually. But this one felt wrong from the start. The nurse who brought me up didn't make eye contact. Her badge said Kira. Young, but her eyes looked exhausted. West Wing's under renovation, she said, leading me down a corridor with plastic sheeting and exposed pipes. Why's the patient up here then? She didn't answer right away. We turned a corner. The hallway ended at a single door. Isolation room. He's post-surgical, Kira finally said. Comatose. Stable. We just need someone to monitor him overnight. Why isolation? Infection risk. Made sense. Didn't feel right, but it made sense. She opened the door. The smell hit me like a fist. That antiseptic rot combination, but stronger now. Underneath it, something else. Something organic. The patient was in the bed, motionless. White sheet pulled up to his chest. His face was turned away from me, toward the window. Curtains drawn. His name? I asked. Kira hesitated. Just call him Patient 12. Records sealed. She handed me a clipboard. Vitals chart. Instructions. Check every hour, note any changes. Call extension 4177 if he wakes. He gonna wake up? No, she said flatly. Then she left. The door clicked shut behind her. I sat in the plastic chair beside the bed. Pulled out my phone. 11% battery. Forgot my charger. Of course, I looked at the patient. Still. Completely still. His chest rose and fell, slow and mechanical. Ventilator, maybe. No, wait. There was no ventilator. He was just doing that on his own. I wrote down the time, 9:47 p.m., checked his wrist monitor. Pulse, 62. Blood pressure, 118/76. Normal. I settled into the chair. This was going to be a long night. By 10:30, I'd scrolled through every app on my phone twice. Battery at 6%. I put it away. Looked at the patient again. Something was different. His head. It was facing me now. I froze. Had it been like that before? I tried to remember. No, definitely no. He'd been facing the window. Now his face was turned toward me, eyes closed, skin waxy and pale. I stood up, checked the monitor. Pulse, 62. Same as before. Maybe the nurse came in while I wasn't paying attention, moved him to prevent bed sores? but I would have heard the door. I sat back down, slower this time, kept my eyes on him. Don't look away, Vaughn. Just don't look away. Minute passed. 5 minutes. 10. He didn't move. I exhaled, pulled out my phone. 4% battery. Checked the time. 11:03. When I looked up, his arm was out from under the sheet, resting on top of it now. Fingers limp. Palm up. My heart kicked against my ribs. I hadn't heard anything. No rustle of fabric. No shift of weight. Nothing. "Hey," I said aloud. My voice cracked. "You awake?" No response. I stood, moved closer to the bed. His eyes were still closed. Face slack. Comatose. But his arm was definitely out. I reached for the call button. My phone buzzed. Text from my buddy Landry. "How's the shift?" I typed back. "Weird. Patient keeps moving." Sent. And then I heard it. A buzz. Faint. I turned. On the patient's bedside table, a phone screen lit up. My text. On his phone. "How's the shift?" I stared at it. My phone. His phone. Same message. Same timestamp. I backed toward the door, slow. The patient's eyes were still closed, but his fingers, they twitched. Once. Twice. Then curled into a fist. I grabbed the door handle. Locked. I pulled again. It wouldn't budge. The patient's head turned. Smooth. Deliberate. Eyes still closed. But his mouth opened. Dry lips peeling apart. And from somewhere deep in his throat, a voice. Not his. Mine. "How's the shift?" I slammed my shoulder into the door. Once. Twice. It flew open. I ran. Down the hallway. Through the plastic sheeting, past the nurse's station. Kira looked up, startled. "What happened?" "He's awake!" I shouted. He's... She stood. Calm. Too calm. "Patient 12 is comatose, Vaughn." He moved. He spoke. She glanced at another nurse. Something passed between them. "Did you take anything tonight?" she asked softly. "Any medications?" "What?" "No. It's a common reaction," she continued. "Isolation shifts. The mind plays tricks." "I'm not crazy." She smiled. Thin. Professional. "We'll send someone else up. You can clock out." I left. Didn't argue. Didn't go back. I checked my phone in the parking lot. The text to Landry was gone. No record of it. I should have paid for the real doctor. That's the thought that plays on repeat. Over and over. Every time I look at my arm. May 10th, 2012. A Riverside dermatology clinic. Except, it wasn't really a clinic. Not the kind you'd find in a hospital directory. Strip mall. Between a check-cashing place and a vape shop. Sign in the window. Walk-ins welcome. Cash discount. I'm Tolliver. Mechanic. Work with my hands. About 3 months before, I noticed a lump on my right forearm. Small. Size of a pea. Didn't hurt. Just there. My buddy said it was probably a cyst. Sebaceous cyst, he called it. They just pop it out. Takes 5 minutes. I called my insurance. $1,200 deductible for 5 minutes. That's when I saw the ad. Minor procedures. Licensed dermatologist. No insurance needed. I should have known, but I didn't. The waiting room smelled like old carpet and bleach. No one else was there. The receptionist was reading a magazine. I didn't look up when I walked in. I filled out a form. Name, date of birth, allergies. No insurance info, no medical history. Just a waiver at the bottom. I signed it. Didn't read it. 5 minutes later, a man in a white coat called me back. "Tolliver?" I followed him. His coat was wrinkled. Name tag said, Dr. Fry. No first name. The exam room was small. Table with cracked vinyl. A rolling stool. Metal tray with instruments covered by a stained cloth. "Let's see what we've got," Fry said. I showed him my arm. He didn't touch it, just looked. Nodded. "Simple cyst. We'll numb it, remove it, you're done." $50. I should have left. But $50. I sat down. He pulled the cloth off the tray. Scalpel, forceps, syringe. He didn't clean them, didn't unwrap anything sterile. Just picked up the syringe. "This'll pinch," he said. The needle went in. Cold flood under my skin. Numbing agent. Lidocaine, probably. He injected again. And again. "That's a lot," I said. "Want to make sure you don't feel anything." Within 30 seconds, my entire forearm was dead. I couldn't feel my fingers, couldn't move them. "Is that normal?" I asked. He didn't answer, just picked up the scalpel. I watched him cut. Felt nothing. Pressure, maybe. But no pain. He worked quickly. Too quickly. Hands moving with the precision of someone who'd done this 1,000 times. Or shouldn't be doing it at all. The cyst came out. He held it up with the forceps. I looked at it, and my stomach dropped. It wasn't a cyst. It was segmented, ridged, like a pill bug. And it was moving, not twitching. Moving. Legs. Tiny, so hair-thin legs unfolding from the sides. "What the hell is that?" I said. Fry's face didn't change. He dropped it onto the tray. "Calcified tissue," he said flatly. "That thing has legs." Nerve response. Happens sometimes. He turned away. Started wrapping my arm, but I kept watching the tray. The thing sat there. Wet. Glistening. And then it moved. Dragged itself an inch across the metal. Toward my arm. "Doc," I said. He didn't turn around. "Doc, it's moving." "You're fine." "I'm not fine. That thing is..." He pulled the bandage tight. Too tight. Then he strapped my arm down. Velcro restraints across my wrist and elbow. "What are you doing?" I asked. "Standard procedure." "For what?" He walked to the door, opened it, stepped out, and locked it. I heard the deadbolt slide. "Hey!" I yanked at the restraints. My arm was still completely numb, useless. I looked at the tray. The sample was closer now, dragging itself across the metal with those thin, almost invisible legs. It left a wet trail behind it. It was coming toward me. I pulled harder. The chair was bolted to the floor. I couldn't tip it. Couldn't stand. The thing reached the edge of the tray, paused, then dropped onto the armrest, right next to my strapped hand. I tried to pull my fingers back. They wouldn't respond. The numbing agent had me paralyzed from the elbow down. It crawled, slowly, deliberately, onto the back of my hand. I felt nothing, but I watched. It moved up my wrist, toward the bandage, toward the incision. I screamed, slammed my free hand against the door, kicked the wall. The thing reached the edge of the bandage and burrowed under. I felt pressure, not pain, just pressure. Something pushing into the wound, going back inside. I ripped at the bandage with my left hand, tore it off. The incision was there, bleeding. But the thing was gone. I could see the edges of the cut ripple, like something was moving underneath. The door opened. Fry stood there, calm, holding a clipboard. "All done," he said. He unstrapped my arm, handed me a paper. "Aftercare instructions. Keep it clean. No heavy lifting for a week." I stared at him. "What did you put back in me?" "Nothing." "I saw it. I saw it crawl back in." He smiled. Thin, professional. "You're in shock. Happens with first-time patients." I left. Ran, really. Didn't pay. Didn't care. I went to the ER that night. I told them everything. They scanned my arm. Ultrasound. X-ray. Nothing. "Looks like a clean removal," the doctor said. But I can still feel it. Every day. Something under the skin. Moving. Waiting. I went back to that clinic 2 weeks later. Gone. Empty storefront. No sign. No forwarding address. just a "for lease" sticker on the window. I don't know what Fry took out of me, or what he put back in. But I know this. It's still there, and it's growing. Here's something they don't tell you. Anesthesia awareness happens to roughly 1 in every 19,000 patients. That's thousands of people every year. Awake, paralyzed, feeling everything. And here's the worst part. Most of them never report it. Because who's going to believe them? The hospital has documentation saying everything went fine. The doctors have plausible deniability. And the patient? They're left with nothing but trauma and the feeling that maybe, just maybe, they imagined it. Medical errors are the third leading cause of death in the United States. Over 250,000 people per year. More than car accidents, more than diabetes. But we trust them. Because we have to. Because when you're on that table, strapped in that machine, locked in that room, you have no choice. You're not in control anymore. They are. And that's the real horror. Not monsters, not ghosts, just people. With degrees and the power to ignore you. If you've experienced medical neglect, anesthesia awareness, or malpractice, you're not alone. And you're not crazy. Drop a comment. Share your story. Someone needs to hear it. I'll see you in the next one. Sleep well. If you can,